With the holiday season underway and COVID quarantines increasing, it's really important to stay on top of your symptoms. With us to talk about what symptoms not to brush off, why you don't want to end up in the emergency room, and how to actually maintain your blood flowing freely during those holiday celebrations and, keeping yourself pain-free. We have modern vascular interventional radiologist Dr. Hootman here with us. Thank you so much for being here. We really appreciate you.
It's my pleasure. I'm glad to be here and talk about some pretty important health issues.
Yeah, first off, a big concern is the rise in amputations due to the COVID lockdown and the overburdened hospital systems. A lot of patients also waiting to get their symptoms taken care of, pretty serious symptoms. Now with the holidays and lockdown, this could become an even bigger problem. What does it really mean, for patients to take their healthcare into their own hands, especially during this time, and especially if they have peripheral artery disease?
Right. Well, there's no doubt that patients that suffer from peripheral arterial disease are probably in that class of people who are at risk for having a severe form of COVID if they happen to get the infection. So it's kind of scary to think about the possibility of going out in public, whether it be to the emergency room, the hospital, or even the grocery store, where you could be exposed to that. So that's kind of weighing on people and has been for quite a while. But I think what we all have to realize is there are other medical conditions besides COVID that are even more concerning. And so we can't ignore things that need to be addressed just because of the COVID situation. It doesn't mean that we shouldn't take precautions. Of course, if we go out, we should be wearing our masks. We need to wash our hands frequently and go to the places that are really only important. So I think people have been putting off a lot of other medical visits because of this fear, which is valid, but it has to be, taken into consideration. And I would encourage people not to ignore serious signs or symptoms that need to be addressed because of the fear of contracting the COVID virus.
What are those serious signs and symptoms, the ones that you say, hey, you can't just walk it off? Walking is not the best medicine for that at this point.
Right. So for the people that already have been diagnosed with P.A.D. and understand what their condition is, they've been maybe through some treatments before, they've had symptoms, and they know how things get better. I think worsening of symptoms is a red flag that should at least prompt a phone call to either your foot doctor or your vascular center to talk to them. Hey, this is starting to bother me. What do you think? But signs that shouldn't be ignored at all are, the number one thing is a wound. If there's a new wound on the foot, or a blister or a change in color of a toe, those are things that really need urgent attention, because if they're left untreated, they can progress rapidly and lead to serious infection and or amputation, which is what we're really trying to avoid in the first place, or one of the major things we're trying to avoid.
And the issue that so many, especially diabetics, have is that one day their foot seems to be fine, and then it almost seems as though overnight it becomes necrotic. Like overnight, it just becomes a serious situation. And a lot of that is due to neuropathy. So it's really important with any sore that develops to check your feet every single night, every single morning. Always keep an eye out.
Absolutely. If you have a family member at home, if you can't see the bottom of your foot and you're concerned, have a family member take a look and snap a photo on the phone and let you take a look at it, or send it to your doctor, and they can take a look at that picture over the internet and maybe advise you whether or not you need to come in and be seen.
I think that's so incredibly important, and it's really important to not just call your primary care physician. It's important to make sure that you are also in touch with not only your podiatrist, but especially your vascular specialist.
Absolutely. I mean, it certainly takes a multidisciplinary team to prevent and manage diabetic foot ulcers. The primary care doctor is kind of the gatekeeper for a lot of patients. The podiatrist is the specialist who's going to help them prevent wounds in the first place by taking care of minor foot procedures and making sure the patient is wearing the appropriate footwear, and they know what leads to problems. And then the vascular specialist is there to kind of help with problems with the plumbing when they arise. That's kind of how I see it as a vascular interventionalist. I work on opening blocked arteries. So in some ways, it is the plumbing of the human body that we're working on.
And especially clear into the foot.
Absolutely.
Talk about pedal loop revascularization. It is controversial, but I come from the school of thought that it's incredibly important. I've seen so many feet saved simply because the doctor was skilled and took the extra time to take that wire and balloon, which are now small enough. When doctors tell patients that their vessels are too small to treat down there, I say, well, how do they treat the coronary vessels then?
Right. So, I mean, there are doctors who have been practicing for a long time. There are doctors who have been practicing for a moderate amount of time, and then there are brand new doctors fresh out of training. And the truth of the matter is, you know, even as little as 15 years ago, it was very uncommon to do an angiogram of the foot when someone was doing an angiogram of the leg. And the primary reason for that is we simply didn't have tools small enough to go all the way down into the vessels of the foot and intervene. So the mindset was, well, if we can't do anything down there, why look? But the coronary arteries, which are the main arteries that supply blood flow to the heart, are relatively small arteries compared to the arteries in the upper part of the thighs and legs. And so the technology that came out of coronary intervention has filtered down into the P.A.D. interventional field. And we now have all sorts of options to treat small vessels in the foot. And so it is important because if you think about it, the toe is about as far away as you can get from the heart. So there's a lot of territory that blood has to traverse getting from the heart all the way out to the toe. And if you don't deal with the vessels in the foot and even to the toes in some cases, a blocked artery can lead to an amputation. And really that once you start going down that path, it's just not a good thing because you lose function. You know, all of a sudden you can't walk as much, and walking is vital to our overall health, especially as we age. And if you can't walk because you've lost part of a foot or worse yet, a leg, that's going to impact your health very dramatically. And so the pedal loop is that final limb in the circuit from the heart all the way down there. And if you think of it in terms of plumbing, or maybe in the terms of watering a garden, for example, I like to use this analogy a lot. The artery in the thigh is kind of big. It's like a garden hose. The arteries that go between the knee and the ankle are kind of like sprinkler lines. And then down in the foot, it's kind of like we have some sprinkler heads. That's one way to think about it. It's pretty simplistic. But you can imagine if you're a gardener and you've got 10 sprinkler heads in a garden box and 5 of those sprinkler heads are plugged up, that garden box is not getting enough water. And so on the other hand, if the garden hose is kinked, there's no water getting into the garden. So it's all important. And if you just open up the garden hose, but you still have 5 sprinkler heads plugged, you haven't solved the problem. So we at Modern Vascular are strong advocates of making sure that we look at the pedal loop on every single angiogram that we do. And if there's a significant blockage in the foot, we treat it.
Right. I love the way you explain it, because I mean, just think common sense wise that you open up a big artery in the thigh, you get that CTO, the chronic total occlusion, that 100% blockage. You get a passage through there, you open it up, you get that blood flowing again, but then it hardly has a place to go. That's a problem.
That's a problem. Absolutely.
And so I can't figure out, I really can't figure out why some doctors wait so long to manage that foot and to get that blood flowing. Some say that they wait till severe tissue loss before actually going after the revascularization of the loop.
Yeah, that's a mystery to me as well. I think in some cases it's people are slow to change. I think that's true in medicine. I mean, there are there are risks with any procedures that we do. And I think particularly in this country, there is some fear amongst physicians that if something goes wrong, they're placing themselves at risk. And so if they've been doing something a certain way for a number of years, they're going to be reluctant to change until they're convinced that the literature has caught up to justify the changes that technology has brought. I think that's true in all of, I mean, if you look at the technological advances in our world in the last 50 years, it's mind-boggling. And it's not just in medicine, it's in all of our lives. And the fact of the matter is the technology is advancing quicker than our literature and all of these things that we like to have around to make us comfortable. So I think some people just don't do it because they're a little bit fearful of changing the way that they've done things for a long time, and we're slow to change.
What are the criteria that you use in determining whether or not you are going to tackle the arch of the foot? And what questions should patients be asking their doctors to determine if it's something that is right for them? And if their doctor can't do it, they should go somewhere else.
Well, at Modern Vascular, our opinion is the foot, the angiogram of the foot should be performed anytime the angiogram of the leg is being performed. And not only do we do an angiogram, but we also do what's called an intravascular ultrasound examination, which is part of the diagnostic procedure, where a small catheter is advanced over a wire through the artery and creates an ultrasound image of what it looks like on the inside of the vessel. And we run that catheter all the way down into the pedal vessels. And that gives us the most accurate information in terms of whether or not there's a blockage, what's the diameter of that artery, and is the plaque, if there is plaque present, does that plaque have calcium in it or not? Because all of those things play into our decision as to whether or not something needs to be treated. Now, so I can generalize and say, for the most part, if there's a blockage less than 50% in a particular vessel, we're probably not going to do anything. If it's 50% or more, that's when we're going to start getting interested in opening it up. Certainly, if it's 70%, we're definitely going to at least do a balloon angioplasty in that pedal loop to improve the flow. We may or may not do an atherectomy, depending upon the degree of calcification in those vessels. And sometimes we even angioplasty the small vessel that goes out to the toe if there's an active wound at that toe and there's an inline stenosis to the artery supplying that toe.
And just for those who don't know, atherectomy is the physical removal of that plaque using a device. You have rotational, directional, laser, orbital. What's your go-to?
We tend to use rotational atherectomy devices, particularly in the foot. These are pretty, again, the technology is amazing. These are tiny little devices.
Oh, you even go atherectomy in the foot. I've had a couple doctors that do it, but that's rare, and that takes some skill.
Right. So we use a rotational device down there that gets pretty small. There's one that goes down to 1.5 millimeters in diameter. It's primarily reserved for vessels with calcified plaque, and that tends to be more prevalent in the foot in people who have kidney disease in addition to diabetes. And it makes it very difficult sometimes to even pass a balloon through the vessel because the calcium is hard like a rock and it becomes very resistant. So sometimes using the atherectomy device will allow us to cut a channel through that calcium and get the balloon in there and adequately expand the vessel.
And here's the thing, with that rock hard calcium, you know, especially in diabetics, that doesn't happen overnight, but a lot of times you might pass off or brush off some of those early signs and symptoms, or you may have neuropathy and you may not feel it until suddenly you say, oh my gosh, that's a sore on my foot. But those are things that the patients need to look out for now, because for some reason, it's not until we're locked down. It's not until we are on the holidays and doctors are on vacation that suddenly you go, oh, there's a serious problem, and it seems to have developed overnight. Can you explain why it's so important to get ahead of this now, because you don't want to go to an emergency room? Emergency rooms are one of the worst places for P.A.D patients.
Right. A lot of emergency rooms don't necessarily have access to vascular specialists, or because of right now, on top of it, with all the COVID thing, there's limited capacity. Their providers are not available. They're on vacation because it's a holiday. And so I think it's important, if there's the symptoms or the signs that we talked about earlier, new wounds, blisters, an abrupt change in color, or all of a sudden the foot becoming cold, those things just cannot be ignored. And if someone is sitting at home over the holidays and wondering, and you're afraid of driving to the ER, probably the simplest thing to do is to pick up the phone and call your vascular specialist, or call your podiatrist and say, hey, I'm here at home, something's happened, I don't know if I should go in and be seen, where should I go? At Modern Vascular, we're going to be open not on Christmas Day, but through most of the holiday. And so we will be doing procedures in our outpatient facilities where you don't have to come to the hospital or the ER. And we have all of our Modern Vascular facilities are basically outpatient clinics with only thing that we do is treat peripheral arterial
Right.
disease. So when you come into one of our clinics, it's not like there's a waiting room with 30 people in there because they've got a cough or something. In fact, right now we do extreme COVID screening in our clinics, and anybody with symptoms is not allowed in the building, or a fever. Everybody's temperature is measured as they come through the door. So in a lot of ways, coming into our clinic, even just to be seen, hey, let's take a look at that foot and decide whether or not something needs to be done, that's safer than going to the grocery store, in my opinion.
And
Yeah.
you bring up a good point that you don't have 30 other people with the cough, and especially with COVID being as contagious as they say it is, with a comorbidity such a peripheral artery disease, you don't want to be around those people. And so it is much safer to not go in the same door that someone who is seeking emergency attention for extreme contagious symptoms. You just don't want to go there. You would rather go somewhere else.
And,
That
and you're also, I think when you go to the emergency room, you are rolling the dice a little bit in terms of what's going to be offered with you, because the emergency room is a place where emergencies are dealt with. And sometimes the solution to emergency is a drastic procedure like an
yes.
amputation, where an amputation might not really be necessary. So I think the ER, obviously there are situations where one only has that option and you have to do it. But if you have better options to contact your vascular specialist and podiatrist and be seen in an outpatient setting rather than an ER, I think you're going to avoid. You have a better chance of avoiding an amputation.
Right. And especially now more than ever, they're going to just go after the most drastic solution because they just got to get you, they got to get you moved through as quickly as possible. They're not going to take any chances. They're going to say, you have a blockage, gosh, let's just chop it off, because in a few weeks, we're going to have to anyway. I mean, if we can't revascularize, and revascularization during some of these, during some of this time during COVID, it hasn't been a priority. Yes, for limb salvage, but that's up to the doctor to decide, right?
Mm-hmm.
You'd think that they, if they're going to go to the drastic attempt of amputating, they would think that restoration or, with an endovascular approach is appropriate, but they don't. I've had it happen several times over the past few months to our friends with that.
And obviously in some facilities, it's not going to happen that way, but how do you know? I mean, there's certainly a risk that you've landed somewhere, and especially in some of these places where the ICU capacity is getting dangerously low because of the COVID numbers going up. I think the whole heightened awareness of, my gosh, we can't risk, having this patient become septic and ending up in an ICU bed. So let's just go to the outpatient surgery center and let's cut this foot off, right?
Yeah.
And that's a really sad thing that could potentially be avoided.
So what can our friends with P.A.D do over the holidays to maintain their blood flow? What do you think? Walking every single day, maybe staying away from some of that extra sugar?
Well, those are always good things to do. I think, I don't want to tell people to not enjoy the hospitals, but walking is really probably, there are two things. I think the two most important things that people with P.A.D can do to reduce the chance of their disease progressing. One is, if you're a cigarette smoker, stop smoking. Not easy thing to do, but if you're successful, that's going to be a huge, huge lifelong benefit. Number two is walking. And if you can't walk, finding some other form of exercise that exercises your feet and legs, like swimming or stationary cycling, something that is exercising the muscles of your legs on a regular basis. And it doesn't have to be walking 5 miles a day. It needs to be walking at least 30 minutes a day, ideally a minimum of 3 days and hopefully 5 days a week. And if you find you enjoy it, there's no reason not to do something like that every day and go walk in a place that you're comfortable, that it actually is something that you find enjoyable. This is the thing that I tell all of my patients. I said, walking is not only going to benefit the status of your peripheral arterial disease. I mean, what's happened? So what's happening? Why is walking so beneficial? Well, what's happening is as you're walking, you're exercising the muscles of your calves and your thighs and your buttocks. And these are large muscle groups that have a very high oxygen demand. So when you're walking, the oxygen demand of those muscles goes up. And there are chemical messengers that are sent to the blood vessels to tell the smooth muscle in the lining of the arterial wall to relax, open up, and allow more blood flow. So that improves the blood flow to everything below the waist when you're walking. And it encourages new connections between the very small micro vessels. So somebody that has a blockage, for example, we have a number of patients who've had blockages that we've treated and we've had to retreat. And at some point we can't treat it anymore. So there's a complete blocked vessel that we can't do anything mechanically for. And yet, if they find a way to maintain a regular walking practice, their body is capable of developing collaterals, which are these small connections between little branches in the muscles and the tissue, that those little bypasses that are being made by the body are enough to alleviate a lot of the trouble and make them functional. It's not perfect, but it is helpful. So that's the reason, number one reason why PAD patients should develop a regular walking pattern. But guess what? There's a whole lot of other benefits from walking too that are relevant to our overall health. Your heart health is going to improve. You're getting your heart rate up. You're increasing the circulation to your heart. You're increasing the circulation to your brain. It's good for brain health. And what else is happening? Well, you're breathing deeper, you're exercising your lungs, expanding your diaphragm, your chest wall. All of those things are making your overall health better. And there are so many studies that have shown that regular walking improves longevity. And it can be done in a very enjoyable way. Now, some people have arthritis and problems that make walking very painful, or they have balance issues or something that make it not possible for them to do. So trying to find a way to make it doable, someone with balance issues having a walker or a specialized cane or something, someone with bad arthritis, maybe swimming, maybe the stationary bike if possible. But it's important to find something that you can do regularly, consistently, that you actually wake up in the morning and think, hey, I want to go do that because it feels good and I feel good afterwards, and it's helping my health.
For me, it's the Hallmark holiday movies, and I get on the elliptical and I now can do an hour because I want to see the end of the movie.
And you mentioned earlier too, avoiding sugars. Of course,
Yes.
especially for diabetics, maintaining, a stable blood sugar level and avoiding spikes is really, really important, because what happens when the blood sugar levels spike is it impairs immune function. And that's when you become at higher risk for developing infections. So, not saying don't have that piece of pumpkin pie, but moderation is important, and really try to balance your diet so that you're eating healthy, eating non-processed foods, things, I'm not a nutritionist and I don't want to try to come off as an expert, but I do think there are two basic things we can say about diet that I don't think too many people will argue with. One, when you go to the grocery store, buy anything that doesn't come in a can or a plastic bag, right? So things from the produce section, things from the meat case, although you want to avoid red meats to a certain extent, I don't think you have to exclude them from your diet. And then the other thing is, in terms of overall health, the basic plan of the Mediterranean diet, I think, has been substantiated scientifically as probably the best diet in terms of health benefits. And I'm not going to go into the details of that, but people can look that up on the internet and learn more about it. I know you have some resources on your website too that talk about practices that people can engage in. I do think the holidays is a good time for people to spend learning more about their health and what they can do to improve it by going to websites like theweightofmyheart.org or like the website that we have at our company, modernvascular.com, where there's a lot of information on the things that we're talking about today.
And you, even on your site, what I like is you actually have, and we have one too, but I like the way yours, you have a symptoms quiz. So you can actually go in and, find out. So if you don't already have PAD and you're watching this for the first time and you're experiencing leg pain or you have that ulcer, a great place to go is to that site to take that quiz.
Yes, absolutely.
Any natural pain relief. That's the number one complaint of all of our friends with PAD. It's the most debilitating disease that so many people have never heard of, but those who experience it, I mean, it is debilitating. And what do you suggest for your patients in terms of natural pain relief?
You're talking about neuropathic pain, or you're talking about pain from claudication?
It's
or both.
Explain both. The difference.
Right. There are two different types of pain that P.A.D. patients experience. The big word I said was claudication, and that's the kind of pain, it's usually a pain or a cramping that people experience while they're walking or exercising. And that's a pain that comes from the muscles because the muscles are not getting enough oxygen. But there's also pain that comes from neuropathy. And that tends to be more often in the feet or the lower legs. And it's usually described as a pins and needles, a tingling, or even a burning sensation.
Mm-hmm.
And so any of those symptoms are telling you you're not getting enough blood flow. And so it probably means that you need to be seen by your vascular specialist, and you may be needing another procedure to open up something that's blocked. That's number one. And it doesn't have to be done emergently or urgently unless you have a wound or a blister or a discolored toe, for example. So over the holidays, maybe that doesn't have to be done. Maybe, try walking, because again, we talked earlier, that is going to cause those arteries in your legs to dilate and improve the blood flow. That may make your claudication come up because you walk a certain number of blocks and all of a sudden that cramping or pain comes up. So you have to stop and rest until it goes away and then start up again. Sometimes for certain types of pain, just sitting up on the edge of the bed and dangling your feet over the edge of the bed, particularly with neuropathic pain in the foot, can sometimes be helpful. I don't know of any other natural remedies or anything like that I found my patients talk about that are reliable. So I don't have I wish I had a magic bullet on that, because wouldn't it be nice to have something that we could take that would make that pain go away?
Yeah, that would be a miracle.
Yes.
You mentioned that, when you do experience that lifestyle limiting claudication, you should end up going and seeing that vascular specialist, and you're more likely than not in need of an intervention. But there are quite a few insurance companies that require 3 months of walking as the best medicine to try that first to see if that improves.
Sure.
And so
many of these. We do that a lot with our patients, and it's a good test, because some people that can actually increase their walking can actually get a noticeable improvement and maybe avoid a procedure. On the other hand, like we talked about earlier, sometimes there are conditions that prevent people from being able to walk enough to benefit, arthritis or balance issues. And so those people give it a 3-month try, and if they just can't get there, then it's probably worth having a procedure to see if we can make things better.
I want to get to some of these questions. Kay, just wondering if it's normal when your popliteal artery is blocked to get a swollen, painful knee, or feel like it's twisted or something. She just can't lean on it, and she even struggles getting into bed.
So if you have a blocked popliteal artery that comes on suddenly, that usually becomes an emergency. And that usually presents as excruciating pain in everything below the knee. It usually does not result in swelling. Mm-hmm. A gradual blockage of the popliteal artery leads to these other symptoms, the claudication, and even can be related to development of neuropathic pain. So when somebody tells me they have swelling in the knee and pain in the knee, we need a little more information about when does that happen. what alleviates it and things like that, because this sounds more like some sort of a soft tissue injury or problem or some type of arthritis that might be causing it rather than an arterial blockage. But we have ways to differentiate that in non-invasive ways. We have Doppler ultrasounds that we can evaluate and find out if there's any evidence of a major blockage in those vessels, and those are pretty easy and painless to do.
Ingrid wants to know about devices such as the Revitive, the massaging devices that claim to, you can get, from Amazon, that you can, they claim to increase your circulation through vibration. Any stance on some of those? I know that many of them have contraindications for people with unstable plaque, people who tend to clot more frequently. And it's in very small print, so a lot of patients don't see it.
I think you have to be careful with things like that. Vibration, I'm not aware of any scientific evidence that is something that will benefit blood flow. Vibration is, basically what you're doing is you're trying to stimulate the nerves down there more than blood flow. And so people with neuropathic symptoms like burning pain or pins and needles, that vibration sensation might actually help relieve their neuropathic pain, because once again, it's a nerve problem. So if the nerve is detecting a vibration sensation at the foot, the brain can only process so much information at once coming through that neural pathway. And so it may detect the vibration as a pleasant sensation, and that may calm down the neuropathic pain. But I don't think it's going to improve the circulation. Is it potentially dangerous? It's probably not seriously dangerous. I haven't had any patient in my practice come in that's used a device like that and had a complication or worsening of their peripheral arterial disease. So I think for people that have neuropathic pain, if they're trying that and it's alleviating their symptoms, check with your foot doctor, see if they have any objections to it, and if they don't, I wouldn't say that they should avoid it.
And there are industrial devices that do this same thing, and they're done under the supervision of a medical professional. And so that might be an option to give it a try first.
Right. So there are other types of interesting technology out there. We use in our clinic cold laser therapy, which is something I would encourage people to look into, because it is a harmless technology. And there are different waveforms of light that can be applied to the skin. And that can have, interestingly, it can help with neuropathic problems, and it can help with wound healing for people that have wounds. I wouldn't suggest that you use only laser light therapy. If you have a wound, you need coordinated wound care, but it as added to an existing wound program, I think it's definitely very beneficial. We've seen some dramatic cases in my practice where adding the cold laser therapy has really benefited people. And there are devices available that folks can purchase for home use. So that's another thing that I would encourage people to think about, particularly those that have the neuropathic type pain.
That's a great tip. We're putting together a wish list for our friends with P.A.D for this Christmas, and I think we're going to add that. So if you have any sort of preference or anyone that you know of that you like, let me know and I'll share it with the group. Steve has a question. I had a femoral bypass, FemPop, in August and angioplasty in September. Now when I go to bed, my lower legs and feel fine, but when I get up in the morning, it takes a while for me to get around without pain. This started before the procedure, but it wasn't relieved after the procedure. Is this a sign of more blockages?
It doesn't sound like it. If he had a blockage, if he was developing a recurrent blockage in that bypass graft or where it connects to the native artery, the first thing that he would notice would be return of claudication. So it would be more like he would get out of bed and go walk into the kitchen and notice some cramping or pain in the calf or leg. Waking up with pain is sometimes a sign of ischemia, particularly in the smaller vessels. I'd have to know exactly where that pain is, but if the pain were in his foot, you have to understand that gravity also helps blood flow get all the way down to the foot. So during our waking hours, when we're standing or sitting, if we have a blockage in an artery in the leg, gravity is actually helping pull that blood through the stenosis. At night, if we're lying flat in bed, gravity's not helping get the blood flow down to the foot. So I find that most often, particularly diabetic patients that have small vessel disease below the knee and in the foot, will be awoken at night with pain, their typical neuropathic pain in their foot primarily. And these people will find that, well, I wake up and then I just hang my legs over the side of the bed, and 20 minutes later it goes away and then I can go back to sleep. I don't think that's what your patient is talking about here. Certainly, if he's had a bypass, he needs to make sure that he's having routine surveillance of that with Doppler, and that will answer the question.
And we have Elizabeth that actually joined us. I don't know if she wants to ask a question live to you right now. Hi, Elizabeth.
Hi, how are you?
Fantastic. Thanks for joining us.
Oh, you're welcome. You caught me off guard there.
Do you have a question for Dr. Hootman?
Yes, I have a lot of questions. Well, a couple of questions. Well, first, I was having cold feet, and they gave me the P.A.D, which is a miracle drug, and it actually helped with my walking and, the pain, and also helped to keep my, feet from getting cold. But I do notice that two of my toenails are discolored. Is that an issue? And also, if I'm walking constantly and building collateral arteries, would the blood flow, clear up the discoloration in my toenails?
Is the discoloration just in the toenail? It's not affecting the toe itself?
Right, exactly.
So that's probably not a compromised vascular problem. If the toe color itself was involved, then I would be a little more concerned. The toenail by itself, if it's discolored, is probably unrelated to the vascular issue. The P.A.D is a very good place to start for people that have mild symptoms. And the fact that you benefited from it tells me that you probably do have peripheral arterial disease in the small vessels of your foot, because that's where P.A.D will be helpful, because what it does is it helps to keep the platelets from aggregating and helps keep the smaller vessels open. So that's a good thing that you should keep doing and keep walking, because the collaterals are that you are building are really important. The toenail, I'm not sure what's causing that. I would suggest you make an appointment and have your podiatrist take a look at it, though. There might be something they can do for you.
Okay. And my next question, thank you for the answer. My next question is, how long does it take to build collateral arteries? And once you build your collateral arteries, how long do they last? Do they stay, or do they just go away? Do you have to keep, building?
That's a great question. And I think the main message here is use it or lose it. And it's just like exercising. Bodybuilders, they go to the gym and they start pumping iron and they notice they get stronger, and pretty soon they can lift more weight, the muscles get bigger, and that doesn't happen overnight. But there are usually noticeable changes in strength pretty quickly with people who do weightlifting, for example. And I think the analogy with building collaterals in people with peripheral arterial disease is very similar. I think if you start doing it, the first time you go out, it's going to be hard. It might be painful. You might have difficulty going very far. And then you start out small, and you start out maybe 2 days a week, 3 days a week, and you go maybe for a half an hour. I try not to tell people to walk a certain distance, because people walk at different speeds. And I think what's more important is the time that you're out there doing it. So for someone who's just starting a walking program, I think 30 minutes, 3 times a week is the place to start. And then try the next week, try 40 minutes, 3 times a week. And let's see how the body responds. And I think if you do it that way, you're going to find that all of a sudden it gets easier and it becomes more enjoyable. And you're going to then notice improvement in other symptoms as you go. So it doesn't happen overnight, but I think even within a couple of weeks, you can have noticeable change. But to have long-term benefit, it needs to become a regular part of life, just kind of like brushing your teeth. And finding a way that it's fun and enjoyable, I think, is important, because some people have never done that. They grew up in a situation where people just didn't do that, it wasn't something they thought of. But if you can incorporate that and make it a regular habit of your life by adding something to make it fun, like I'll tell people, go walk to the coffee shop and get a good cup of coffee or a cup of tea or something as a reward to get you out there and doing it. And before long, you're going to find that just being out in the fresh air and getting your heart rate up and meeting other people who are out there, you're going to find a lot of other benefit, enjoyable things about doing it regularly and make it just like brushing your teeth.
Right.
Elizabeth, are you getting out and walking?
Well, I have a walking pad in my house because it's kind of chilly out there. So I would either turn on the television or turn on some music, some hip hop music, and walk to the, to the beat of the music.
That's great. That's whatever makes it enjoyable and fun for you is absolutely wonderful. Treadmills are just as good as walking outdoors, and I think people should utilize them. If you have the means to have a treadmill at home, that's wonderful. I've had patients before who used only a treadmill and had dramatic improvements in their walking capacity, and went from the treadmill to finally saying, "Hey, my wife wants me to go for a walk around the neighborhood," and now they've graduated from the treadmill and they do go out. And I agree with you. It's kind of cold out there right now. It might start snowing and get icy, and that gets dangerous too. So we have to make good decisions and use the resources that we have and do what works for our individual situations. And you are doing the right things.
Elizabeth,
Yes.
are you happy
Thank
with
you.
your vascular specialist? Are you getting the care you need now?
Well, I haven't, not really. We can talk about that. And it's mainly my fault because I don't really go out to the doctor's office
And why is
because of
that?
COVID.
Yeah.
Because of COVID.
Mhm.
Because of COVID. So
Right.
I'm just trying to maintain myself where I am now. And hopefully once COVID is over, I can go in, maybe April, May, go get another ABI test done. But right now I'm just trying to maintain myself on my own.
So does
know.
your vascular specialist provide telehealth options to do video visits?
Yes.
So that's something you can still do very safely during the COVID thing. And if nothing else, they talk to you and see how you're doing, and then they can make sure that you're getting the things that you need to have done. If you need to have your ABI retested or something, they can tell you, well, it's okay to wait until February or March to get that done based upon what you're telling me.
Yes.
It's always good to have. It's always good to have that follow-up appointment
I was
made.
just going to ask her, what part of the country does she live in where it's kind of chilly right now?
I live in North Carolina.
Oh, okay.
So it is kind of chilly. I mean, some days we have warm days, but it's a little chilly.
Yeah, it's
me.
It's that way a lot of places right now. Well, you keep doing what you're doing. Use that treadmill and keep moving.
Okay,
Thank
great.
you.
I have one last question.
Okay.
Infrared heat, is that good for circulation, and are massages good for circulation?
I think the infrared heat or any kind of heat actually is probably beneficial to improving the microcirculation in the skin for a short term, because it's warming the tissue. And a lot of times when it's cold or the surface temperature of the skin is cold, some of the vessels in the skin will constrict to conserve heat. So warming that foot up will allow those small vessels in the foot to dilate a little bit, and that will at least temporarily improve the circulation in the foot. So, coming in after a cold walk outside or something and applying that, any source of heat, whether it's infrared or even a heating pad, can actually be beneficial in the short term. And so certainly not going to be harmful in any way. And I'm sorry, what was the second part of that question?
Massages. I was reading that, massaging your legs is not good because you might, release a blood clot or a blood, something, I don't know. So I wanted to know, because I like to go get body massages or even, do it myself.
Right.
Is it good to have
So
massages?
for the most part, I think massage is probably not dangerous for people with peripheral arterial disease, unless they're doing, something with a very firm roller device right directly over the top of the foot where the arteries are right underneath the surface of the foot. But if we're talking about thigh massage, calf massage, and it's somebody just doing it with manual manipulation, it's very unlikely to cause problems with peripheral arterial disease. Now, dislodging a clot is a different thing. And usually when we talk about dislodging a clot, it's in the venous system where people get DVT. And so if someone had new swelling in their calf or leg or new pain in their leg, that would not necessarily be the time to go have a massage. That would be time to sort out what's causing that new pain and swelling before you do it.
Right. Okay, great. Thank you.
Thank you so much, Elizabeth, for
Thank
joining
you.
us and participating. She is just a wonderful, wonderful woman, and I look forward to talking to her again very soon. And Dr. Hootman, any final thoughts? Thank you so much for all your time. Any final pieces of advice?
Well, I will say, we've been talking about some serious things and scary things potentially with COVID and the serious parts of peripheral arterial disease and things, but we are coming into the holiday season, and it is important to have meaning in our lives as well. And I would encourage people to have some enjoyment over the holidays. Don't overindulge, use moderation, get outside and walk, breathe in some of that crisp, fresh winter air, and, have some positive things too. Don't be living in fear constantly, but do the smart thing. Wear the mask, wash your hands if you have to go out in public, and think about who you're visiting and think about the risks that they might have too.
Thank you so much, Dr. Hootman with Modern Vascular in Albuquerque, New Mexico. We really appreciate your time.
Thank you. I appreciate being invited to participate and talk about these really important topics. And you're doing a great job with the weight of my heart. So thank you for being a patient advocate and helping inform patients about what PAD is all about and finding ways to get treatment and avoiding problems.